But you can also talk about a child that comes from an environment that is so impoverished that the only way of keeping in touch with reality and having some sense of feeling good comes from constantly touching themselves. So you have a child that's 4, 5, 6, 7, 8, 9 years old that is constantly masturbating. It doesn't always mean that they have been sexually abused, but they are abusing themselves in a sort of way, and these people can also become sexual addicts at a later time. But it always talks about some kind of abuse and deprivation, but very often sexual. As among the people that are educated about the subject, you know that there is increasing numbers of males that are coming out and describing themselves as having been sexually abused. But the numbers for women is about 1 out of 5, and the numbers for men is about 1 out of 10. And these are conservative estimates. The thing about sexual abuse that makes it different from physical and mental abuse is that it's hard to explain away this action. You can somehow get yourself to, you can convince yourself with a lot of work that your father meant in your best interest when he punched your teeth out for chewing with your mouth open at the dinner table. And it was because he wanted to make you a man of etiquette. But for a child that has been sexually abused by its parent, it is something that they just cannot come to grips with. And they simply cannot explain away why it would be in their best interest that their parent abused them. What they are left with is a web of lies about themselves. What they are left with is guilt. Because children, even children that are compelled to have sexual intercourse by adults, come away with a feeling of guilt. They feel that they have enjoyed it. Now, you blindfold the child and stimulate their genitals, they're going to get excited. But what is left with that excitement is a terrible sense of guilt. And this is the reason why this guilt gets compartmentalized. It becomes the roots of low self-esteem. You have good people that cannot look you in the face. People that walk around like zombies because they have to hide this shame. They have to hide this guilt. They have to compartmentalize it, live with the feelings but not have the memories. And this is the reason why sexual abuse is very, very deeply hidden away. I have known people that have been abused for 15, 20, and 30 years by their parents and step-parents and don't remember it when they come to your office. These things remain compartmentalized. So there is something different about sexual abuse and something much more grievous in the kind of wounds that it causes, in my opinion. You have physical problems like very strongly psychosomatically and psychophysiologically. Psychosomatic is strongly connected with body and mind. Psychophysiologic is where there are actually physiologic changes taking place because of stress. And we're talking about migraine headaches, irritable bowel syndrome, pelvic cysts, persistent cysts, problems of the stomach, chronic back and neck pain, things like this. Female problems, excessive bleeding, painful bleeding, exaggerated PMS. Now, I have to tell you that every person that goes through, that has these problems need not necessarily have come from an abuse, but anybody having this problem with some of the other problems must maintain a high index of suspicion that they may have been abused in childhood. I've had women, for example, that have gone to their gynecologist and found lots of lacerations in their vagina and scar tissue, and then it has come to them in the form of flashbacks that they've been abused. In my opinion, what happens is children that have been subjected to a tremendous amount of stress at an early age fail to develop the kind of harmonious rhythms in their neuroendocrine system. Let me see, I'm looking for to see if I have a picture. So right at the top you have your cerebral cortex. This is where all the thinking stuff takes place. And underneath that you have the feeling part of the brain, very roughly speaking. And after that you have the spinal cord, and along the spinal cord you have the autonomic nervous system, which has to do with controlling all your unconscious processes, heartbeat, gut, bladder, things like that. And then you have the endocrine system, which is the pituitary, the hypothalamus, which is part brain and part gland. You have the pituitary, you have the parathyroids, you have the thyroids, you have the adrenal cortex, and you have the ovaries or the testes, depending on the men or women. Now, all of these glands have a certain rhythm. And in early infancy and childhood, when the brain develops, that's the time that this rhythm is set. Okay? The daily waking and sleeping, activity when they sleep, enrichment, stimulation, excitement when that keeps them awake, that keeps their reticular activating system going. Love and excitement makes their brain grow, full of things, full of magic. And then night puts them to sleep. And it is in this rhythm of sleeping and waking that the brain becomes molded in this environment of love, that this kind of rhythm. The glands get their rhythm. And I have found that children, that people that come from a background of abuse, where they've had to spend sleepless nights waiting to be intruded upon, have their ears closed with their fingers because they don't want to hear the screaming in the other room, or the out-of-control sexual activity, or their mother's fifth boyfriend slapping her across the room. If they don't want to live with it, their waking and sleeping becomes disturbed. They lose what we call the architecture of sleep. And there is a certain kind of balance of REM sleep and non-REM sleep and all of these things. And what happens in people that come from a background of abuse is that they don't have these internal rhythms. Therefore, they suffer from chronic sleep disturbances. Therefore, they suffer from chronic disturbances of the different kind of glands. You have obesity problems. You have shifts of eating on both sides. You have all kind of what we call endocrinopathies, just little changes in the endocrines. Feeling weak, feeling tired, chronic feelings of fatigue. And the thing you got to know is, these are things that can be tested today. Today you can do 8 or 9 tests that will tell you that you've got an endocrine system that's mildly out of whack, and maybe it has something to do with the fact that you never got it in the first place. And these are the things that you need. You need to know these things because knowledge is power in a very immediate way, and knowledge is power. Because if you don't know these things, you're going to have to listen to somebody else's answers as to why it's happening. You know, you need to empower yourself with this knowledge. Okay? So, I believe that early abuse and stress and a lack of love and a horrendous type of early environment causes this kind of chronic problems, and then you have chronic problems with sleep. So when we talk of treating all of these things, one of the first things that I address is treating sleep. We'll come back to that. So first thing, you've got to understand and recognize the fact that maybe your problems, maybe your lack of blossoming or your persistent suicidal tendencies, uncontrollable suicidal tendencies, your bulimia, your tendency to be drawn towards the worst person in the crowd, all of this come from a background of abuse. You got to make that connection, and you got to keep that connection. You always have to remind yourself, because your brain is always working to hide it, because that is how you have survived childhood. So your brain works very hard at trying to forget it. So you have to work very hard at keeping yourself reminded. That is why thinking about childhood, listening to childhood, exploring your dreams of childhood, going through your old magazines or your photo albums, journaling, exploring your dreams, talking to people that have known you in childhood, all is very important. For people that have not been tremendously traumatized, they're going to remember most of a good part of their childhood. It is the people that have been hurt most of all and who have the most serious problems very often that we have to go on to more elaborate and sometimes more intrusive methods, such as we do in clinic and hospital settings, like hypnosis and sodium amytal interviews. But since we are talking about empowerment, you got to know that there are many, many things that all of you can do to get in touch with childhood all on your own, without having to go to a clinic, without having to go to a doctor. Not everybody needs to get hypnosis. Not everybody needs to have intrusive procedures like sodium amytal interviews. But then there are people that are going to need them, and those are the people that have been struggling with their problem for 8 or 10 years, 15 years, 20 years, a lifetime, being misdiagnosed, being given brain-damaging medications without really getting to the roots of the problem. And I think for those people who simply cannot get in touch with what happened in childhood, things like sodium amytal interviews and hypnosis are helpful. Okay. Some of the other symptoms that I use as guides for looking at abuse is loss of bladder and bowel control. I've seen a lot in their 30s and 40s that have quote-unquote stress incontinence or just lose control of the bladder, and you always want to look at the possibility of them having to deal with great fear in their childhood, because you often hear the expression, "I will scare the S out of you." So it's that, because what happens is fear goes from, when it cannot be dealt with in a reasonable manner, affects the non-unconscious part of the brain, and then it goes into the autonomic nervous system. There is an autonomic overload, and this causes an autonomic imbalance, and so this fine-tuned control of parasympathetic and sympathetic control goes out of whack, and that's the time people have things like diarrhea and loss of bladder control, shaking, and things like hyperventilation, things like palpitations, all the generally recognized anxiety symptoms. What's the problems with misdiagnosis? It's very common. I have told you that it's a very common thing. 1/5 of women and 1/10 of men in this country have had some exposure to some kind of sexual abuse. Double or triple that for emotional abuse. It takes between 8 and 13 years for some of these problems to be caught. That is going to therapists. Misdiagnosis is very common. What are some of the problems that people have when they go to therapists, and why is it not recognized? A lot of it, I feel, comes just from the whole attitude within the community of psychiatry and mental health. More in psychiatry, to a lesser degree in psychology, and to an even lesser degree in the fields that primarily have more women. But there is a very adult type of attitude, which means we are adults. We're not children, so we don't listen to the voices of children. Okay? We have a very masculine attitude. Even those who are women who have come into psychiatry or OBGYN don't listen. They've already trained this feminine side of them out of it. They may save it for their husbands, but they don't save it for their patients. There is also a society attitude that encourages not listening to children. Okay? Children and women are not to be heard. You've heard the old, children are to be... that's right. Okay. Okay. And then, as we get to be adults, abused children go on to abusing their own inner child. And that is the biggest crime, and that is the one crime that you have the handle on. From the time that you know that there is something inside, that is somebody inside you hurting, that is the time to make the change. You must never close your eyes or never close your ears to that voice inside you. People may not come and tell you about their abuse, and that is one thing that therapists have to know all the time. You have learned to hide your shame because it is connected to your own guilt. You have learned to hide it because you're afraid of talking about it. Children have seen what comes from talking about it. Oftentimes it's more punishment. So patients have many reasons why they don't come in touch with their abuse. They may lie to protect their own guilt, be afraid of talking about it, because it's, especially men, and I think this is very great with the male abuse population. They are even more afraid of coming out and talking about abuse. In the last few years, there has been a tendency where we have encouraged women, empowered women with being able to talk about their abuse. It's still very hard for men to come out, and the kind of expressions of male abuse, which very oftentimes is molestation in themselves, having paraphilic tendencies, is something you don't want to talk about. People don't talk about things like, I feel like molesting little children. You simply don't talk about it. It doesn't matter about exploring these things, about looking at maybe there is a lot of pain that inside this person that causes them to have this kind of loss of control. Never mind that. These are not things you bring up. And society is very harsh in dealing with people like this. They incarcerate them, they shame them, they punish them, they brutalize them. Better when this is all the result of shame. You also have other problems such as denial and repression, and then you have the amnesia barrier, which prevents a person coming in touch with the pain. In the very young, and the adolescent population, some of the indicators of sexual abuse, again, are persistent. For those that are therapists here, or those who have children, persistent bedwetting, sleepwalking, severe disturbances of sleep, nightmares, a persistent sadness, talking of suicide, extreme withdrawal, psychotic type of behavior, hallucinations, things like that. All of that, you've got to look at the possibility that maybe inside the home or outside the home, somewhere in their environment, they're being traumatized. Runaway behavior should make you think about it. And you look at it, sometimes for an adolescent to run away from home is probably the healthiest thing. You've got a very brutalizing environment and a discounting environment, an environment where they're being physically brutalized or sexually abused. It is strength for such a child to leave a home. Misdiagnosis comes from looking at all the multiple effects that abuse brings on. Behavioral problems such as sexual addiction, behavioral problems. Now you talk of behavioral things because this is what people notice, and that's how they diagnose things. Sexual addiction, self-mutilation, hyperactivity in children, anxiety, panic, where you're actually doing things and acting out with chemicals and eating disorder, mood changes, thought problems, for example, hearing things, seeing things, things like that, and personality disturbances. These are the areas in which therapists and doctors make misdiagnoses, and this is why you need to keep in touch with why these things may be happening. What are some of the dangers of misdiagnosis? For example, the biggest problem is that it is a repeat of the betrayal that you've gone through. It's one more time in which people have betrayed you. What I find is that people coming from a background of abuse alternate between, in a childlike manner, they're either very mistrustful or they're excessively trustful. But the one thing is they're always trusting people that they shouldn't trust. And then as time goes by, they become increasingly trustful because every person that they manage to find from this crowd is somebody that mistreats them and abuses them all over again, and this tells them that they cannot trust people. And so as they get older, they become more and more mistrustful. In their 40s, 50s, and 60s, they become paranoid, and then they get labeled as paranoid, schizophrenic, etc., etc. So a lot of people coming from a background, I often ask my parents, that come from a background of abuse, what was your grandmother's problem? She was diagnosed as schizophrenic. How was she when she was young? She was okay when she was young. In her 40s and 50s, she was locked up in such and such state hospital because she became very, very paranoid. Well, abuse is a multi-generational problem, and oftentimes in the lives of these same grandmothers there has been abuse, because it is people that are abused that oftentimes cannot see abuse. It is oftentimes in the homes of women that themselves have been abused that a situation develops where the children are abused. So we have to be caring of the full family. We cannot just focus on the child and say that it is all the fault of the parents, but then the parents are victims themselves, and you have to treat the whole family when it comes to something like this. There is abuse within the therapeutic community. Abuse as in the abuse of drugs, as we have talked about it. Abuse as by not giving them the right treatment. You also have abuse such as sexual abuse. Now, for those people that are not from within the therapeutic community, it is hard to believe that therapists will actually abuse their patients. But it's true. I have many, many patients that have come to me who have been sexually abused by their therapists. And it happens for a reason. These same therapists, it doesn't condone anything that the therapist does, don't get me wrong. But it does happen to people that come from a background of abuse, that they get abused again and again. They give out these signals to these people, and they don't know how not to give out these signals to these people. Sexual signals, because they have connected intimacy with sex. Love with, not love with respect, but sex with purely as a way of getting. One thing I recognize is that sexual addicts, people coming from backgrounds of prostitution, mud wrestling, escorts, all of these, where in a way they allow themselves to be dehumanized sex for money, etc., that there is always a history of abuse in the background, because people that have not learned to dissociate love from love and respect, love and sex, are not going to be able to do these kind of things. You cannot walk up to somebody, a crowd of people that you don't know, and take off your clothes while they're sipping beer and walk 3 feet away from their faces and flash your groin at them. Normal people cannot disconnect from such feelings because it produces all kind of reactions within them. It is people that have been subjected to dehumanized sex that are going to perform dehumanizing actions of sex, including prostitution. There is always molestation. I have not seen a person that has become a prostitute who has not had molestation. I read the book by the one that acted in Deep Throat, and I believe that this is a person who has not come in touch with her molest, because she takes her father to see one of her latest productions. I mean, can you imagine this? Yeah. And she never mentions abuse. There is her husband that has been having her in pornographic films, lending her out to the dentist, lending her out to the chiropractor to get his work done, and then he calls her to a hotel room with cameras and everything going, and he has a couple of guys come and gangbang her, and then she's surprised that this wonderful husband of hers should subject her to something like this. It is because the signals in people that are abused don't go off at the right time. It is because there are large covers on their recall, large things that suppress their past. We also have problems with codependent therapists and doctors, because a lot of people go into this field out of their need to get people better. I'm not saying that I am better than anybody else or anything of that kind, but the one thing I have to tell you is that somebody that I meet at the beach or at the ball game is just as important as somebody that is agonizing or wants to die. I can see that they are in more pain. I used to do surgery before, and I have seen death at close quarters a lot of times. But it doesn't make me more endeared to them just because they're in physical agony. I mean, they don't become more important human beings. But there are a lot of people who have this need to save. So therefore, they will go through long periods of treating people without confronting them, without compelling them to take charge. Seeing people in after month, year after year, not addressing problems that are needed, never asking, why did you put on another 15 pounds, or why did you miss the appointment last time? Basically, codepending their patients. Nobody, in my opinion, nobody should be in therapy for years and years. There is no reason why anybody should be in therapy for years and years. There is no condition that a person has as an adult that should not be in a well-set direction of progress in a year's time, preferably in 6 months' time. Even people that have tremendous amount of amnesia, people that have psychotic symptoms, multiple personality disorders, all of the people with eating disorders, nobody should have to suffer endlessly. And it is again the codependence and this feeling of powerlessness that makes them feel that somehow life is to be just waited till you're 40 or 45 or 50 and then things can change. You can't afford to wait. Do you think about death, you know? I mean, how many of you think about death? I think about death all the time. All the time. It sits on my shoulder all the time. And what it does for me is that it makes me strong. It tells me that I cannot waste a moment today in terms of what I have to do, who I have to love, and what I have to say, because I might not make it through tomorrow. You know, we all have to live with the thought that not only that we might die in great agony, we might die in a long period, it might take a lingering death, we might be dismembered. We live in LA, there's people dying on the streets all the time, there's people that blow people away. You can't wait. You simply cannot wait. Waiting is part of not feeling powerful. You simply cannot wait and let the days fritter away thinking that someone or something is going to change. The one thing that I hope when you leave this place is feel empowered with knowledge and also make the decision to change your lives. Not just a thought in your head, but something that gets acted upon. Okay? The other problems with, okay, so you have misdiagnosis and being in touch with codependent therapists that kind of let you linger on in your sickness, not enforcing things like exercise, not enforcing things like taking good care of your medical problems, which comes secondarily to not making your body strong and not sharing, these kind of things. Not being strong enough in terms of confronting the person with their codependent relationships, their habits, their chemical dependencies, all of these things. The other problems with misdiagnosis are addiction to prescription medications, worsening of medical problems, worsening of obesity, which is very often a consequence of abuse, and denial of abuse, hypertension, back and neck pain, things like that, becoming narcotic pain medication addicts, and of course some of the long-term problems of using medications such as Thorazine and things like that that I've mentioned. I also need to mention in passing that even though that some of you may not know that both alcohol and cocaine can cause very severe chronic disturbances of the brain. In fact, alcohol, even though people may tell you LSD makes you crazy and stuff like that, and a lot of it is true, the most dangerous drug today is alcohol, followed by cocaine. And alcohol is the one thing that we have known only for the last 2 to 3 years that cocaine causes lesions. You're looking at the blood flow in their brains and which parts of the brain are active and which are inactive. You find certain patterns in depression, patterns in mild degrees of brain injury, and you find certain patterns in cocaine abuse where you find little spots all over the brain, both in the cortex and inside, that make them look like they got senile dementia, which is like old age related brain rot. So this is the technology that we use, and the PET scan, electroencephalograms, beams. These are the kind of tests that we do today that a good clinician ought to do, that will tell us very clearly if this is a brain-related problem or related to things that are from your past that you have not dealt with, or is it a combination of both? Because we cannot exclude it. Okay, so both cocaine and alcohol cause lasting changes in the brain. Cocaine causes lasting changes in the brain. It can also affect the heart. The alcohol, on the other hand, causes tremendous amount of brain damage. It affects every part of the brain. It affects the part that thinks, that remembers, the part that controls your mood, the part that has to do with balance. It also affects the peripheral nervous system, all the nerves that go to the different parts of your body. It affects every organ in your body. One thing that I like to tell adolescents that drink, as well as adults, is that it causes testicular atrophy. It means you have all these ads for all these macho people that are drinking beer, but the consequence of drinking any kind of alcohol for long periods of time is that your testicles become soft and they go away. They disappear inside your scrotum. So this is one thing you want to tell males that drink. If you drink for long periods of time, it causes testicular atrophy. And this is not something that is something I'm telling to scare people. I worked at the VA, and I used to spend whole days doing this kind of thing. I mean, not just feeling their testicles, but also putting big needles into their swollen bellies just so they could walk around. You drain off a gallon or two of fluid from their body just so they could be walking around without pain, because it's very hard when your stomach comes all this way to be walking around. Here, let's have the lights. Okay. So when you choose agents such as alcohol to forget pain and not deal with the hurts of childhood, you are continuously hurting the mind. One thing that you have to do in terms of recovery is stop hurting yourself, whether it's in very direct ways like banging your head as a way of dealing with your pain, or drinking or using cocaine, or walking away from physically abusive relationships, or shaming relationships. You got to stop hurting yourself. And that means staying off drugs. Okay. Okay, the things that, okay, just to sum up. One thing is knowing and keeping in touch with the knowledge of childhood. Keeping yourself in a safe environment so you can work with this knowledge. That means being with people that are not abusive, not being with people that are abusing drugs and alcohol, because they are dealing with their pain in a way that you don't want to deal with it. You want to be among people that are recovering. This is one of the reasons why I started the Adult Survivors of Child Abuse. This is the reason why I send people to codependency groups, because they are in an environment of people that are empowering themselves, staying in touch with their pain, so they know where to direct their efforts of love and care. They know where to listen. Stop the abuse from going on themselves and others, whether it's a job, a husband, a boyfriend, a wife, children, whatever. Exercise. Exercise is an important part of self-empowerment, because the one thing that people are always hurting and feeling guilty about is having lain there and taken it, not having screamed, not having walked away. Let it happen day after day, night after night, and having to live with the shame of that. And it is this apathy that has to be actively fought with exercise. Exercise must be done on a regular basis. It has to be done every morning, or preferably early in the day before you start your day. You don't leave it for those times when you got your favorite boyfriend on with your favorite jogging suit and everything feels wonderful. That is not the day you want to go and exercise. The day you want to exercise is when you feel like shit, when you don't feel like getting out of bed, when the world feels dead to you, when you don't have any power. That's the day that you need to exercise. And again, these things are not going to happen unless you do it by habit. So you have to create good habits. You have to create good habits of exercise, good habits of staying awake in the daytime, doing things that enrich your life. You must get from nature and the rest of the world and all the wonderful people in this world what you don't get from your parents. You get bad dreams of your parents on your shoulder all the time. You have to let it go and get it from the community, get it from your friends, get it from nature. We have wonderful things today. You know, people talk about the world being so wicked, and we have satanical, ritualistic abuse going on. We have Hitler. But I'll tell you something. I mean, 6,000 years ago, Genghis Khan killed 6 million people with swords and flames. People being inhumane is not a new thing. We always have to live with it. We have to look at it inside ourselves. It's when we don't hear what is going on within ourselves, and we don't hear it in our children, and we don't listen to our children, either as professionals or as parents, and we don't listen to the voices inside ourselves of our inner child, that's when we are running into a problem. That's when we dehumanize ourselves. Okay, stabilizing, exercise, staying stimulated and doing self-worthy things, not abusing drugs and alcohol. Knowing how to stay by yourself and feeling good, that is part of empowerment. Self-soothing, whether it's by music, fishing. One of the things I tell people all the time is go fishing. Okay? Fish don't hurt you. Okay? Animals don't hurt you. It's important. You got to know you can spend your time with yourself, love yourself, not be destructive, and go towards damaging relationships. It's very, very important. And learning how to sleep well. The only medication that I'm fond of prescribing for sleep, which I think is very important, establishing a good sleep pattern is very important. And I find poor sleep patterns all the time in people that come from traumatic backgrounds. And the one thing I tell them is you must pay attention to sleep. You mustn't create irregular habits where because somebody that you like came, you are compelled to sit up to 3 o'clock in the morning, even though you have to go to work at 7. So creating a balanced habit of sleep and waking is very important. It's like stroking. Okay? It has greater implications than that. The architecture of sleep decides the rhythm of your glands. And if the architecture of sleep, the balance between REM sleep and non-REM sleep are not in sync, then every gland in your body becomes disturbed. The growth hormone becomes disturbed. You get anemic because it's the pulsations of growth hormone in a rhythmic manner with rhythmic sleep that allows the bones to sprout blood cells. It is what keeps the immune system strong. So good sleep and exercise are important parts of staying healthy in body and mind. You can use L-tryptophan to treat sleep because it's an amino acid. For people that suffer from very serious sleep disturbances, there is a medication that you might want to write down, which you might want to ask your doctors about, and it's clonazepam. You will not find its use in the PDR because it's listed as an anticonvulsant, which is for the treatment of seizures. Okay? But it is very helpful for the kind of sleep disturbance that we find in people coming from abuse backgrounds, which is what we describe as post post-traumatic stress disorder. And I had thought of bringing the psychiatric glossary with me, it's definition of words. Post-traumatic stress disorder, i.e. a mental state and set in symptoms and behaviors brought on, for example, by combat. For those of you among here who've been in combat, I would like you to visualize two scenes. One is being... That is very traumatic. Yes, it's traumatic. Of course it's traumatic to see people that you love being blown up. Okay? But take the other scene of being 4 or 5 years old or 3 years old and having your old man walk up behind you in a drunken rage and put you in a chokehold and put his knees in your back and struggle you to the ground and stick things inside you that he shouldn't be doing. Okay? Now, which is more horrifying and which is harder to live with? Okay? I think that everybody that comes from a background of abuse suffers from a post-traumatic stress disorder that causes them symptoms for a lifetime until they think about the original hurts and empower the knowledge and learn to go beyond that. But in treating, they also need to treat some of these symptoms, and sleep is one of them. So you can take unhealthy medications for sleep, because taking medications that are regular hypnotic sedative medications, instead of bettering sleep, are going to worsen it eventually. You take any sleep medications long enough, it will create a disturbance of sleep, which means even a person that doesn't have a sleep problem will wind up with a sleep problem. We talk of exercise, walking, running. People often ask me, what about walking? Well, walking is good. It also causes certain kind of chemical changes in the body and mind, but running is different. Running and heavy physical exercise with sweat breaking in your head, having your heart race, feeling your muscles twitch, that's the kind of exercise that empowers you. And you've got to do it every day if you want it towards strengthening yourself and fighting the passivity of abuse. Okay? Both impulse control problems and passivity, because impulse control problems are just the other side of the coin of passivity. It is for people that are not decisive. People that don't feel empowered cannot be decisive. Either they're impulsive or they are apathetic and passive. Okay? So exercise is an important part of the treatment of impulsivity and passivity. I often send my patients, both female and male adults and children, to martial arts classes, and their parents or their spouses are often shocked because they think, oh no, it's not good, because they'll learn to fight even harder, they'll get more out of control. But it's not true, because if you feel strong, then you don't need to feel threatened. Okay. We talk about, so exercise is an antidote to apathy and to impulsivity. Working with rage, you've got to come in touch with the rage. Working with grief, you've got to come in touch with the grief. In every person that has gone through abuse in their childhood, there is a lot of rage. They have felt homicidal towards their parents. They have kept this knowledge for themselves. They're ashamed of this knowledge. They don't want to admit it to themselves, because they don't have a real strong enough bond with their parents that says that even if I have such horrible thoughts, like I have felt like sexually drawn towards my mother, or I have felt rage towards my father where I wanted to see him dead, because there is not strong enough of a bond of love, they have to hide these feelings. And you've got to get in touch with these feelings, because everybody or most people go through feelings of anger and sexual feelings towards their parents. Either they cover it up tremendously or they cover it somewhat. But getting in touch with rage, getting in touch with grief, learning to say goodbye to the idealized childhood, learning to say goodbye to the idealized parent, and learning to live with them as parents, as people, with all their limitations, is an important step in discovering your own power. Just like I have to tell people the limits of what I can do to them every time, and I tell them sometimes in very crude ways, such as, even if you plan to jump off the 6th story of the federal building, I'm still going to be out on the beach with my gin and tonic and my kids. I don't do that, but I want them to hear that my life is not going to be changed by what they do, and it is not right for me to tell them that somehow I'm going to be able to stop them from committing suicide. They are the only ones that can stop themselves from killing themselves. I tell patients all the time that it takes 15 minutes to kill yourself between checks. So even in a hospital setting, a person can kill themselves. The desire and the strength to live must come from within. It can never come from outside. And if the desire to live and the need to live comes from outside, it is not worth it, and sooner or later, okay. Groups. Before that, we get to massage. Massage and body work, in my opinion, is a very important part of self-love. People that come from a background of abuse either have not been touched and soothed because their parents are too depressed or too much into fighting or not feeling good about themselves. They have not been touched, stroked, handled with love and care, or touch has meant for them being brutalized. They have been, touching means being beat on, touching means being sexually invaded. And for those people, their sense of boundaries, their respect for themselves comes by therapy. You also have to feel empowered to get help. You want to do it before you become so old or so mistrustful that you can't go out there. But you make the decision. You shouldn't think about therapy or going to therapists as something that's from the outside. It is just like if I want to take a shave, I don't feel compelled to pull out every hair. I don't mind buying the latest kind of razor if it helps, okay? It's just a question of getting help. And it should not be a counter-dependent decision like, I think one way of proving my power to myself is running away from home. One way of proving my power to myself is not to go and seek a therapist. It is always the people that run away from home when they're 13 and 14 that are at home at the age of 35 fighting with their parents. Okay, so there is no problem when you're young getting help from the outside. You just have to be careful about who you choose. You shouldn't have to be in therapy endlessly. You shouldn't be taking mind-damaging medications. Preferably you should be taking no medications at all. Okay, you don't want leaning on relationships. You don't want relations that lean on you. You don't want environments that are discounting and reinforce your denial. You want a therapist that is 100% with you while they are there, but not somebody that seems to be there endlessly for you, jumping up when you call them at 2 o'clock, again there at 4 o'clock, because there's something wrong with that person if that is all what he is doing, and he may be part of not allowing you to get in part with your self-soothing mechanisms. And that is not empowering, that is this.
You have just heard a talk by psychiatrist Mohan S. Nair, MD, medical director and founder of the ASCA Co-Dependency Centers of Bellflower, California. The centers specialize in inpatient and outpatient treatment and education and training to promote better understanding of codependency and abuse. For additional information, you may phone 213-866-5810.